Coccidioidomycosis, also known as valley fever, is a fungal disease caused by the Coccidioides species. This fungal species live in the soil of semi-arid regions. It is endemic in such areas as the Southwestern United States, parts of Mexico, and South America. It is a reportable disease in states where the disease is endemic, such as California, New Mexico, Arizona, and Nevada. Of people who live in an endemic region, about 10 to 50% will have evidence of exposure to Coccidioides. Most of the people who get the disease are people who live in or visit places where the fungus is in the soil. Many also engage in activities that expose them to dust. People get infected with Coccidioides by inhaling fungal spores that become airborne after the disturbance of contaminated soil by humans or natural events such as dust storms. The infection is not spread from person to person or from animals to people. The infectious form of the fungus exists when the fungus grows in the environment. The fungus changes its form when it infects a person, and this form cannot be transmitted from one person to another. It is important to note, however, that Coccidioides growing in culture as a mold in the laboratory may cause infection in laboratory personnel if the cultures are not handled properly and the appropriate precautions are not taken. About 60% of infections do not cause any symptoms. People who develop symptoms may experience a flu-like illness with fever, cough, headache, rash, and muscle aches. Most people make a full recovery within weeks to months of symptom onset, but a small number of people may develop chronic pulmonary infection or widespread disseminated infection. When the infection spreads outside of the lungs, it most commonly results in skin lesions, central nervous system infection, such as meningitis, and bone and joint infection. Some people are at increased risk for developing disseminated infection. People of African American, Asian, or Filipino descent appear to be at an increased risk, as do pregnant women during the third trimester and immunocompromised persons. Environmental testing can help identify when the fungal spores are present, and this can allow people to take extra precautions to avoid exposure to this fungal pathogen. To learn more about prevention and environmental testing services, please visit the website shown on the screen.
IAQ TV, the place to be.